So thank you for having me at this important event in IGCS 2022. I'm honored to be a part of the team of this session here. I'm Noriko Fujiwara, an oncology nurse and a research nurse who work for the University of Tokyo, Japan. I will talk about the survivorship journey and some tips for success in the journey. Dr. Shankar already said that the term of survivor, cancer survivor, was proposed in the 1980s. The term is intended to raise awareness of better outcome and changing needs. People who named the term said the most important thing is to be able to explain and discuss your medical and emotional needs with your healthcare team and a loved one. So as you already know, a person with cancer is a survivor staging at the time of diagnosis, during and right after treatment, and through the balance of their life. Family, friends, and caregivers are also affected by the survivorship experience, and thus with the definition of a survivor. There are many types of survivors, including those living with cancer and those free of cancer. This term is meant to capture a population of those with a history of cancer rather than to provide a label to individuals. My mother is one of cancer survivors. She overcome thyroid cancer. When I was elementary school student, I was so shocked to see the big scar on his neck. So there are two important points of this definition. One is that we need to take care of all stages of the cancer process, and cancer affects individuals as well as their significant relationship. So I want to introduce one famous essay about cancer survivors in 1985 in the New England Journal of Medicine, titled Seasons of Survival, Reflections of Physician with Cancer, written by Dr. Muran, himself a cancer survivor. His statement afterward led to the formation of the National Coalition of Cancer Survivor, NCCS, in 1986, led by with 25 patients who had experienced cancer. The NCCS appealed to society for the importance of considering not only the outcome of treatment, but also the process of living through and after cancer for the individual and his or her family. And Dr. Muran told the concept of 3 seasons of cancer survival in his book. The first season is the acute phase. This period begins with diagnosis and the fight against cancer with medical treatment. Because this period is the acute of facing cancer and cancer treatment, cure quality of life sometimes declines. Dr. Graspol, one of our chairs, conducted a study of the lives of gynecological cancer patients 12 months after diagnosis, and found that their quality of life declined 3 months after diagnosis. This result also shows the difficulty of this acute period. It's so hard period. And the second season is the extended phase, when the patient transitions to life outside of the hospital, but continues treatment and struggle to rebuild his or her life in the work environment while struggle with the fear of recurrence. And the third season is the permanent phase. It describes that even if you survive cancer, it will continue to be a part of your life. Various environments and relationship are affected by the cancer experience, and the secondary effects of treatment are new factors. The essential thing to know is that these seasons are not experienced in a linear fashion. It's not a roadmap. Depending on the recurrence, patients may return to acute phase, and the expanded phase may be long or short. They need to be considered in terms of their impact on life. And it's important that patients, families, and healthcare professionals be aware of the protect against the impact of difficulties throughout this entire season. For living in these highly fluctuating and uncertain seasons, better communication between patient, families, healthcare professionals, and a lot of supporters would be one of the success keys. However, I think you can imagine that these situations easily. Conversations with healthcare professionals in clinic and hospitals tend to be very short. After the visit, you may often think that you didn't tell what you want to say correctly and sufficiently. You may not know what to ask and when to ask it in the first place. There are so many questions you want to ask your doctor. So what is communication? How to communicate with healthcare professionals in this journey? Cancer survivorship can be a long journey, so people need to change over the course of their lives, and we all have different values. Yeah, this is not only for patients and their families, but also for the healthcare professionals themselves. So communication requires others to understand you, so try to let others know about you. And effective communication is two-way, structured, and continuous communication is the key. So let's think about our communication strategy. In communication with healthcare professionals, we can think about it step by step. Before you visit, you can prepare for your conversation with your doctor. First, write down what you want to say and what you have in your mind. In short, rushed situation, it's common to forget about what you want to say. So if you found the information on some website and in a book, you can print it out and bring it. Excuse me. The most important thing is to prioritize what you want to ask, what you want to say. And sometimes it's effective to pass note prepare before your visit to your nurses. And to save your precious time for conversation, look up simple term or simple medical word in advance with an internet search. You can ask them for medical term you don't understand, but it would be a waste of your valuable time to have them explain the meaning of just words. So during your clinic or hospital visit, you can communicate with nurses, don't forget nurses, and other healthcare professionals before you see the doctor. They will help you sort out what you're having trouble with and what you need to say, and ensure the essential signs, vital signs are not missed. Finally, it's time to talk to your doctor. It will be more effective to ask your questions and in about 2 or a couple of sentences with what, why, when, how, what you want to know, what are you concerned about this, And when do symptom or concern occur, and how do you want to do? And it will help you after reading there if you can write down the information you receive or ask your family to do it. And your conversation end is your last chance to ensure what you want to know. Summarize and tell them briefly what you understand. And when your concern addressed, improved, or your symptom improved, give good feedback to healthcare professionals. The mood in your conversation end can greatly increase rapport, build trust, relationship with your healthcare professionals, and maintain positive emotions. So there is, Dr. Shinker already explained about the checklist. There is something to help you on the website here. By NCCS, they provide a survivorship checklist and ASCO cancer treatment survivorship care plans. This survivorship care plan was created by Dr. Fujiwara, the incoming president of IGCS. And you can communicate with healthcare team using this kind of a lot of tools. So this is my last slide. As you could learn about clinical research this morning, clinical research is collaboration work to create our future. So your voice always important. Your point of view always matters. People with different perspective work as a team to create the future together. Thank you.